This is NDTV, and you're watching NDTV 24/7.
Good evening, you're watching NDTV with me, Rishika Barua. This is a show where we take your questions on the coronavirus. We'll be joined by a panel of expert doctors who will answer some of those questions. Today we want to focus on two very interesting studies that have been done by the World Bank and by Harvard Health, who have in fact made some kind of a connection between air pollution and coronavirus. So can increased exposure to high levels of air pollution actually make you more susceptible to the infection? We'll be putting out some information, and of course you can call our specialist doctors and ask them any questions if you have any. Dr. Sambit Das, a professor of endocrinology, the High Tech Medical College, senior consultant endocrinologist at the Endeavour Clinics and the Apollo Sugar Clinics from Bhubaneswar, is joining us on the broadcast. Dr. Raman Chawla, the chief interventional cardiologist, director, CareMax Hospital from Jalandhar, is also with us this evening. Doctors, I want to begin by asking you about these studies that have been put out. Dr. Das, if I could come to you first, what do you understand as the link between air pollution, exposure to high levels of pollution? Does that put you at a higher risk of the coronavirus?
Yeah, actually the relationship between this coronavirus and air pollution is a little bit murky actually, but nevertheless we have some data, and as you have quoted, the recent Harvard one study has come that has shown that the places where the pollution was at the peak or is higher, there the mortality and the severity of the coronavirus, and in fact the prevalence is also higher. And one of the postulation what they are telling is that probably the pollution or pollution particles are actually the vectors, or they are the vehicles for that virus. And the other thing is that they are telling once a person is living in a polluted environment, or when the air pollution is at the high, then those group of people are more suffering from bronchial asthma, COPD, or something like the other respiratory diseases. So that can actually predispose us to this deadly virus, corona.
All right, Dr. Chawla, no such study specifically, done here in India, but India is among, one of the most polluted countries in the world. We have our cities, in the top indexes of world pollution if you look at the global figures. Does that put us at a disadvantage because there isn't any data so far which is India specific, which makes the relation between coronavirus or susceptibility to the coronavirus and air pollution?
Right. See, we don't have data specifically to India as per relation of pollution to coronavirus. But as far as overall impression and studies is concerned, as it has been pointed out, that these particles act as a vector to transmit disease from one person to another person. Not only that, people who have been staying in this polluted country for so many years, their immunity comes down. So they have less capacity to fight with this infection. And that puts them into more serious condition, right?
Well, so very interesting perspective, doctor. There, you're essentially telling us that your immunity is anyway compromised if you are susceptible. If you are exposed to high levels of pollution, and that could, in fact, not just increase your chances of getting the coronavirus, but if you do end up getting the virus, you could have chances of developing complications.
Yeah.
Right. All right. Our first caller, Dr. Ramana Rao, is dialing in from Hyderabad. Go ahead.
Good evening to all of you.
Hi.
Yeah.
Good evening.
After lockdown, we had to lead a new normal life. My question is regarding the teaching community. Whether the scientists or lecturers or professors has to take the class with mask or without mask. Why? Because even if you have social distancing in the class, what is your suggestion regarding taking the class with mask or without mask?
Yeah.
All right. Doctor, would you like to take that on? Yeah.
Yeah. So a very nice question actually, and it's thought-provoking, and we all know that after this lockdown is over, we are not expecting things to be normalized, and it will be something like after corona for maybe 1 or 2 years more, or maybe longer. So for all practical purposes, we have to lead a different life where we maintain a social distancing at all time to come and maintain our hand hygiene and all those things. So even after the lockdown is over, even if you are going to the college, you need to wear a mask because there are some evidences that it might be droplet infections or it might be aerosol infection. So it's better to wear a mask and keep a distance of 1 meter at least from your students. But nevertheless, the e-learning will actually take a major thing in future, and I think we all should be prepared for those e-learning or e-platforms and all those things.
All right,
Can
so
I add
very interesting perspective there. Dr. Chawla, is there anything you'd like to add? There is going to be a lot of question, even though educational institutions are not opening anytime soon. The government's made it very clear that until and unless they don't think the conditions are safe, no examination will take place or schools or colleges will open. But what would you like to say, Dr. Chawla, to anyone who has these inhibitions?
See, basically, it's not a question of this time. It's going to be lifestyle now. Even if corona goes away, you should have a lifestyle of wearing masks and keeping your hygiene absolutely fine.
Right.
So it's not a question of this time. Post-corona era also, whatever time is going to come, you have to be lifestyle that you have to be keep your hands washed, hygiene and mask has to be worn, even if things are over.
All right. Our next caller, Vijay Tariq, is dialing in from Mumbai. Go ahead. Mr. Vijay, can you hear us? All right, we'll try and reconnect with Vijay Tariq there, caller dialing in from Mumbai. But if I could just come back, doctors, to what we were talking about earlier, which is the issue of air pollution. Dr. Das, could you explain to our viewers some of the adverse effects of air pollution related problems, and especially for people like us who live in the cities, we are vulnerable to air pollution no matter how many air purifiers you have in your homes or office spaces. How does that affect your immunity?
Actually, the air pollution itself is killing a lot of people even before corona, and there were like many respiratory diseases which were more prevalent in polluted areas or air polluted areas. Like you have asthma, you have COPD, you have other respiratory problems, runny eyes or runny nose and sore throat and all those things. So that actually leads to some lowering of the immunity, and that puts those population at a very vulnerable place,
right.
And they are more affected with any respiratory pathogens, say corona or any other respiratory viruses.
Right. All right. I believe we do have Mr. Tariq back with us on the line. Vijay Tariq dialing in from Mumbai. Do ask your question. Mr. Tariq, can you hear us?
I can hear now.
Yes. Please ask your question,
Good
sir.
evening, sir.
Hi.
Hello. Hello.
Good evening,
Yeah,
sir. We
please.
can hear you. Please ask your
Hello.
question.
Was operated for heart bypass surgery before 2 years. So if I catch an infection, then HCQ treatment will be okay, or I should?
All right. Dr. Chawla, you're a cardiologist yourself. So what would you recommend to anyone who has a predisposed heart condition, has just been operated, or has undergone surgery in the near past?
Okay, see, no drug is safe if you take it when it's not indicated. And if it is indicated, you have to see the risk-benefit ratio. In a person who has undergone by surgery, some heart disease, heart surgery, and his underlying heart disease, it's not safe to take any drug, especially medical supervision.
Right.
These are things that these are supposed to change.
Doctor, I'm afraid we have a terrible audio line with you there. We're going to try and re-establish that connection and perhaps get you to answer that question once we fix that audio line. But our next caller, Shrikant, is dialing in from Chennai. Go ahead.
Hello?
Yes, sir. Go ahead. Ask your question.
Yeah, okay. I understand that this has got to do more with the air pollution, but because I'm calling from Chennai, I'm audible?
Yes, we can hear you. Please ask your question.
Because I'm calling from Chennai, I just wanted to clarify a small point. I guess yesterday or day before, the government actually came out and said that
Chennai is a red zone, the whole of Chennai, I'm saying, irrespective of the containment zone. 98% of the Chennai population is asymptomatic. Okay. Now, what do you do in such a case when you have when actually you have an when they come out and say 98% is asymptomatic? Is it? I'm more. It's not academic, but would practically, because the doctors would
right.
you we have moved from remdesivir to some HCQ to so many things, and then the only thing which we have not touched upon was herd immunity.
Right.
Do you think it
Let
is
me,
right for?
Okay, let me take that question, to Dr. Das, who's with us on the broadcast. Dr. Das, lot of questions about asymptomatic carriers, especially in red zones. And of course, there is no drug, no cure, no vaccine for the coronavirus, which is out there in the market just yet.
Yeah. So the thing is that the coronavirus itself has got almost 80 to 85% would be asymptomatic, or they will have minor viral infection or flu-like symptoms. 15% will have some kind of chest symptoms, which might be a little bit more compared to asymptomatic, and 5% will have only serious infection. Out of that, 2 to 3% is the mortality. So this is exactly the total figure of anyone who is suffering from corona positive or COVID positive. So the thing is that since many are asymptomatic, we are actually careful about those people who are highly vulnerable, like those who are more than 60 years, who have diabetes, CKD, or liver problem or heart problem. So these asymptomatic patients can actually transmit them to this group of vulnerable patient, and they can manifest it very badly with a high mortality. So the basic thing is that why now the society is trying to contain even the asymptomatic thing is that because they are spreaders, they will spread the disease. So it's better to contain that, to make the graph, you might have seen that graph, to flatten, so that there is a smoldering infection and people will get either herd immunity, or those who are vulnerable, if they are affected, can be taken proper care.
All right. I believe Dr. Chawla is also back with us on the broadcast. Doctor, apologies for that line. But, please do go ahead, Dr. Chawla, and complete your answer. Heart patients, of course, are very concerned about their susceptibility to the coronavirus. And also many say that, if you have a predisposed condition, then the virus could lead to complications. Do complete your answer, doctor.
There are two aspects of looking at it. One is people who have heart disease, they are more prone to disease, number one. Number two, people who have disease and heart problems, then if they take chloroquine, is it going to be harmful or good? People who have heart disease, they are definitely more prone, especially if they have high blood pressure, to this coronavirus, and disease is going to be more severe in those populations. Now coming to as far as chloroquine is concerned, we should not take any drug which is not prescribed by a qualified doctor for any disease. For corona, taking to chloroquine. Chloroquine is not a safe drug at all. It has definite side effects, especially in people who have heart problem, undergone bypass surgery. In those situations, chloroquine is possibly can cause change in heart rhythm, heart speed, and that can cause sudden death also.
Right.
So we should take chloroquine only absolutely indicated under strict medical supervision. Otherwise, we should not take chloroquine.
All right. I think that is something that, all doctors on the broadcast have reiterated time and time again, that only take medication under supervision from your doctor. Don't try and, read things off the internet and self-medicate. But, let me also take this to Dr. Das. Dr. Das, it obviously applies to diabetes patients as well, doesn't it? Anybody who has a predisposed condition, we're talking about exposure to air pollution here, but anybody who has a predisposed condition is at a higher risk, aren't they?
Yeah. So anyone who has got any chronic diseases, mostly that's diabetes or heart disease or hypertension or any kind of kidney disease, they are absolutely at a very vulnerable stage. In that place, pregnant ladies are also quite vulnerable. So all those groups of people are to be safeguarded, and they should be kept absolutely safe by their family members.
All right. Our next caller, Ravi Kumar, is dialing in from New Delhi. Go ahead.
Hi, good evening, doctors, and good evening, ma'am. I live in Southeast Delhi. So the problem is that before lockdown 3.0, we were not observing many people on the street, and shops were also not closed. Only vegetable shop and grocery shop was open. Nowadays, from my balcony, when I see people roaming in the streets, because all shops are open and everybody is going out and coming in, so the fear factor is increasing to mind, and we are not able to go for milk and vegetable also, because we don't know who has come, and because many people are coming and going. How to handle this situation, because we have to go at the end of the 2 or 3 days to go buy for milk or vegetable.
All right, let me get Dr. Chawla first to respond. Dr. Chawla, there are concerns now after the lockdown period, now that there are considerable more number of people on the road, more shops are allowed to open. People are scared of venturing out. What would you advise them?
See, basically, it's a question of relativity. Now, at this relative time, we need to have essential goods also to survive. It's not only scare of virus and getting inside always. Now, if you go out in a crowded place, obviously you must wear a mask. You cannot go out without wearing a mask. And try to keep at least 1 meter distance from a person who is standing alongside with you. You cannot help it. You have to save yourself by keeping social distancing. You cannot teach somebody to do it. If you do it yourself, everybody does it that same way, then obviously we have a specific space in between, and you have to wash your hands, wear mask always. This is the only way you can prevent disease from happening to yourself.
All right, very interesting perspective. In fact, many doctors are also now saying that all of the rules and regulations, the protocols that you followed, good practices during the first 2 periods of the lockdown, they need to be followed and perhaps only be enhanced, as more number of people are out there on the streets. Our next caller, Ranjita, is calling from Bangalore. Go ahead.
Yeah. Hello. Good evening, doctor. Good evening, everyone. My question is to Dr. Das. Today, people are prone for the allergies, like they have the sinusitis, bronchitis, all these problems. How fast, because of air pollution, how fast this COVID can connect your sensitive sinus valve? That all those. What do you say on that?
Right, Dr. Das.
Yeah. So basically, air pollution. What the postulation is that in the recent articles is that this pollution particles are actually working as a vector or a biomedia by which the virus is spreading to the normal people. And if someone is having sinusitis or some respiratory tract problem, then that epithelium or those small cells throughout the lungs and throughout the airways are actually defunct, or there are some abnormality in that, and in those abnormality the virus can attach very nicely and it can go enter into the cells very fast. So for any kind of respiratory infection which the person is previously having, like asthma, COPD, sinusitis, or any kind of respiratory illnesses, the person has to be more and more careful. And if somehow he or she is living in a air polluted area, then he or she is still more vulnerable. So they have to be more careful.
All right. Dr. Mahesh Rath is dialing in from Bhubaneswar. Go ahead.
Good evening, sir. My question is for Dr. Sambit Das. With the Ramadan going on now, do you have any specific advice or precautions for patients of diabetes who are observing Ramadan regarding protection from COVID-19?
All right, Dr. Das.
Yeah. That's a very interesting question actually, since since our Muslim community is now observing Ramadan. So for Ramadan, there are two things which they should be careful. First thing is that in the evening they usually gather for a good and sumptuous meal and some prayers, and ideally people should avoid such gathering. They can do it at their home and they can pray to God, but don't gather. And if at all there is some gathering is there, at least try to maintain at least 1 meter of distance from there. Again, the hand hygiene, the airway hygiene has to be properly taken care of. Second, a person who is diabetic and is observing Ramadan or the fasting, my take on that is that the glycemic control has to be absolutely under control. You better so to your doctor, try to adjust the doses or the insulin or the tablets and try to keep the blood glucose at a very controlled level.
All right, so that's very useful advice for anyone who's observing either the Ramzan or any other form of fasting at a time of a pandemic. We're going to slip into a very short break, but Dr. Das and Dr. Chawla will continue to be live with us on the other side, so do keep your questions coming. Welcome back. Dr. Das and Dr. Chawla continue to be with us on the broadcast. I'm afraid I have very little time left, but Dr. Chawla, if we could just go back to where we started, the issue of air pollution, because I think it concerns everyone. We've had a lot of reactions coming in on social media as well. What can people do now? People who've lived in densely air-populated cities, air pollution, where they've been exposed to a lot of air pollution all their lives, what can they do now to build immunity?
See, first thing is they should avoid touching what is called a T-zone. T-zone is basically surrounding over eyes, nose and mouth. This is the zone from where the actual viruses enter. So they should try to avoid touching T-zone directly or indirectly. Now, as far as increasing immunity is concerned, I'm sorry to say it's not a question of hours or days. It's a question of months. It takes time to build up immunity. But at least right time to start at least now.
Right.
You should take absolutely healthy diet, which basically means you should take a lot of fruits, green leafy vegetables, do regular exercises, do regular yoga, and try to be stress-free. That is most important part.
Yes. Right. I think that's a very interesting note to end this on. It takes months to build your immunity, but what better time than the present to start that process. Appreciate you both, doctors, for being with us on the broadcast, for taking out the time of day to answer those questions so patiently. Coming up on the other side is the 8 o'clock news with Sonia Singh. Big numbers, all the updates. Sonia, what do you have for us?
Thanks, Rishika. Well, the big numbers, cases going up, but here's the good news. India's death rate is still very, very low compared to the top 5 nations. Also, well, it's been a terrible May 2020 so far, because today, tragedy as there's a gas leak in Visakhapatnam. Lots more after the break.